If you fail to follow through on your New Year's resolution to stop smoking, a new opportunity to quit is here. This is National Non-Smoking Week, and despite significant gains in reducing rates over the past 2 decades, progress seems to be stalling. Joining me now to share some of the latest data and to offer support to those wanting to quit is Rob Cunningham, Senior Policy Analyst with the Canadian Cancer Society. Rob, good to speak with you.
Hi, Maralee. Good to be with you.
First, maybe just give us an idea of how many Canadians still smoke.
Well, we still have 11% of Canadians who smoke, 3.6 million people. That's quite a lot. We have made progress. 1965, 50% of Canadians smoked, including 61% of men. But still, we have this objective of under 5% tobacco use by the year 2035. We have an enormous amount of work to do to get there.
You know, tobacco remains the leading preventable cause of death in this country, killing some 46,000 Canadians every year. The dangers of it are well known. They're right on the packages of cigarettes. So why do you think people still do it?
Well, in many cases, it's an addiction. They may have begun as a teenager. They wish they could quit. It may take many tries to quit smoking. But we are seeing the progress. We just have to keep it up. And of course, the tobacco industry has opposed stronger laws that will help reduce smoking, including youth smoking. So we have to pursue these stronger laws despite that opposition.
There's so many alternative nicotine products on the market these days. Vaping devices, well known. These nicotine pouches seem to be very popular today. Many people see these as a better option than smoking. So I'm curious, are these products helping or hurting smoking cessation efforts?
Well, they are on the market. They are available to people who want to use them. But a fundamental concern is the extremely high rate of youth use of these products, youth vaping, and now youth use of these nicotine products, nicotine pouches. We have, among high school students in grade 12 in Canada, 27% who are vaping. That's triple the rate of smoking. It's triple the rate of where it was a number of years ago. And we need more measures to reduce youth vaping, including in Manitoba, minimum age 21 instead of 18 for both tobacco and e-cigarettes, curtailing remaining promotion, a whole series of other measures, including by Federal Health Minister Marjorie Michel to restrict flavors in e-cigarettes. It's a major factor contributing to youth vaping.
All right, you mentioned some regulations you'd like to see beefed up. You also mentioned Canada's tobacco strategy to get to less than 5% tobacco by 2035. Do you think that's still achievable? I mean, we're less than a decade, into that guideline now.
It is achievable, but it all depends on how much we do, especially governments, in terms of a comprehensive strategy of taxation, regulation, and enhanced programming. Manitoba and other provinces right now have a historic opportunity because of the tobacco lawsuit settlement. Manitoba is going to be receiving $1.1 billion over the next 20 to 40 years, payments every July. It's a great opportunity to strengthen the provincial strategy in terms of cessation programs, youth prevention programs, community initiatives, better policies, stronger enforcement, youth vaping, and so on. Now, Manitoba is going to allocate some funds to a new cancer center from the settlement. Obviously, we strongly support that. At the same time, there could be strengthened efforts to reduce smoking and youth vaping in the province.
For those watching right now wanting to quit, what advice can you offer, and what supports are the best bets?
Well, to mention as a reminder that there's a toll-free number on every cigarette package. People can call for free advice and assistance. There's a web address. People can speak with their doctor. People trust their doctors. There are nicotine replacement products such as gum and patch. There are prescription medication products available. But one idea is that many people have not calculated how much it costs each year for cigarettes. It could be several $1,000s. And then they could use that for a vacation or towards a car, down payment on a house, or many other things. And so that financial motivation may combine with the health motivation.
Well, Rob, I want to thank you so much for the tips. It was great speaking with you.
My pleasure. Thanks very much.